If medical conditions stress you out, especially heart conditions, then this video is for you. I'm going to walk you through the most common heart conditions you'll see in dental hygiene, what actually matters for clinic and boards, and how to remember them without memorizing a textbook. If you're new here, I'm Felicity. I'm a dental hygienist and I create study resources to make hygiene school and clinic feel less overwhelming. So, heart conditions come up constantly in medical histories, and knowing how they affect dental treatment is huge for both boards and for real life clinic. And before we get into specific conditions, let's quickly talk ASA classifications because this helps you mentally categorize patients. I always think of ASA like a ladder, so the higher the number, the higher the risk. ASA 1 is healthy patient, ASA 2 is a patient with a mild systemic disease. ASA 3 is a severe disease but stable. ASA 4 is a constant threat to life. ASA 5 is not expected to survive without surgery. And ASA 6 is a brain dead patient. Almost all of the patients you'll be treating in a dental setting will fall between ASA 1 and 3. Now, hypertension is known as the silent killer because patients can feel totally fine but still be at risk for a stroke or kidney failure. So, arteriosclerosis is stiffness, and atherosclerosis is plaque. Now, this plaque can either cause a heart attack, also known as a myocardial infarction or MI, or a stroke. So, plaque in a clot in the heart is going to be a heart attack or MI, and that plaque in the brain is going to be a stroke. And a quick blood pressure tip, if you remember nothing else, remember that 180 over 120 is a crisis. Now, in clinic, if you're dealing with a patient with hypertension, you're going to want to raise the chair slowly, watch out for hypotension and dry mouth, which both of those can be a side effect of high blood pressure medication. Now, angina is chest pain caused by decreased coronary blood flow, usually triggered by stress or excursion. And it's important to remember that angina is temporary pain, not permanent damage. The pain can radiate from the jaw, the neck, arm, shoulder, and usually lasts under 5 minutes. Now, a key differentiation is angina is relieved by rest, oxygen, or nitroglycerin. And that comparison is to an MI, which is on the next slide. These two can often be confused with each other because the symptoms are very similar. So it's important to note the key differences because they are very different from each other. Now, when you have a patient with angina, morning appointments are typically recommended and a stress-free environment, and we limit epinephrine to 0.04 milligrams, which is about 2 carpules. And now we're going to jump into myocardial infarction, which is also known as a heart attack. So this is different from angina because this is permanent damage. So ischemia means no oxygen, and this is what happens with angina alone. Now, when it comes to myocardial infarction, we add the word infarction, which means tissue death. So in angina patients, they do not experience the tissue death. And in an MI episode, they do. So remember that ischemia means no oxygen and infarction means tissue death. Now, if the pain doesn't go away with rest or nitroglycerin and lasts longer than 30 minutes, that's an emergency and how we know it's not angina episode, but rather an MI or heart attack. And we delay elective treatment for at least 6 months after an MI. So no dental treatment after 6 months after having a heart attack. All right, so congestive heart failure means the heart is not pumping effectively, so blood backs up, and that's why we see congestion. And it's important to remember that the left side is the lungs and the right side is the extremities, meaning left sided failure causes fluid in the lungs, and right sided failure causes swelling in the hands, the feet, and the abdomen. So these patients may not tolerate being in a supine position. Breathing can be difficult, and we avoid ultrasonics and air polishers. Arrhythmias involve abnormal electric conduction of the heart. So, some symptoms to remember: when I hear the word arrhythmia, I think of rhythm in music. So, for symptoms, think, how would a skipped or fast heartbeat feel? So, we're thinking palpitations, dizziness, fatigue, shortness of breath, and even fainting. And something to note for clinic is that older pacemakers may not be shielded, and newer ones usually are. Power scalers are avoided with unshielded pacemakers, and epinephrine can make arrhythmias worse. So it's important to ask your patient, and if they're unsure, then follow up with their doctors whether or not their pacemaker is shielded or unshielded. It's better to know for sure. You'll often see surgical history listed instead of the actual condition. Sometimes patients will put one or the other. So it's important to know what the surgeries are for. So here are the most common heart surgeries for us to know as dental hygienists. A coronary artery bypass graft, or CABG, is done when the coronary arteries are too blocked to be opened safely. So instead of fixing the blockage, surgeons create a new pathway for blood to reach the heart. They take a healthy blood vessel from another part of the body and use it to bypass the blocked coronary artery. I think of a CABG as a detour. We're not fixing the traffic, but we're going around it. So if a patient has had a CABG, that tells us that they have significant coronary artery disease. Now, an angioplasty and a stent is different. Instead of bypassing the artery, we're trying to open it back up. So a small balloon is inserted and inflated to widen the narrowed artery, and then a stent is placed to help keep it open. The balloon opens it and the stent holds it. So a CABG goes around the blockage, and an angioplasty and stent work through the blockage. So when a patient has an angioplasty and a stent placed, it's less severe and a more localized disease. It's chosen when there are 1 to 2 narrowed coronary arteries, the blockage is accessible, the artery can be safely opened, and the heart function is still relatively preserved. Now, when a patient has a CABG, they have more severe, widespread disease. Means that there are multiple blocked coronary arteries. The blockages are extensive or complex. The patient has significant coronary artery disease, and an angioplasty just wouldn't be effective. These patients are often on antiplatelet therapy, which can increase bleeding risks. So always review the medications carefully, because patients may leave certain medications out if they don't think that it's important to us. So you can often make this simpler for yourself by really digesting the information, and instead of just trying to memorize it, just try to memorize keywords, because there are often keywords in each condition. So don't overlook it and try not to get overwhelmed. If you want flashcards, slides, and study guides to help you with this and to make the information actually stick, you can join my free school community, Tooth Fairy Club, where I share all of this information. I will also be posting the PDF version of these slides over in the community. So make sure you're subscribed for more hygiene school and clinic focused videos. And thank you so much for watching. I'll see you in the next one.